Good morning, Mr. Chair, members. I'm proud to present AB 1930, which is sponsored by our Attorney General, Rob Bonta, and by Equality California. And this is a bill which will defend healthcare access and enforce California's protected health activities laws for all who provide and receive care in the state of California. California has long been, excuse me, a place where people can access the healthcare that they need and live authentically, safely, and with dignity. But across the country, we're seeing a coordinated effort to roll that back. Efforts to intimidate patients, to target providers, and to attack reproductive health care and gender-affirming care, which is simply health care that allows people to live who they truly are. And we've already seen consequences of that right here in California. Last year, the United States Department of Justice issued a subpoena to Children's Hospital Los Angeles seeking information that could identify thousands of transgender youth receiving care that they receive with the support of their families and their doctors. That action didn't just raise alarms, it had real consequences. It put privacy and safety at risk, and it contributed to the closure of the Hospital Center for Trans Youth Health and Development, cutting off access to care for young people who need it most in the state of California. That's just simply unacceptable. No one should have to fear that seeking lawful medical care in the state of California could put their privacy and their safety at risk. AB 1930 will protect patients and providers by requiring business entities in California to notify the Office of the California Attorney General if they intend to respond to a subpoena or inquiry regarding legally protected healthcare activity. Before an entity responds, they must first notify the Attorney General of the inquiry within 7 days of receiving it. They must make reasonable attempts to notify any individuals who the inquiry pertains to within 30 days of receiving the notification, and they must wait a minimum of 30 days since they notified the Attorney General to respond. This bill also gives the Attorney General authority to both intervene and enforce the provisions of the bill, including through civil action and civil penalties. Let's be clear, California will not buckle under to threats meant to intimidate our communities. We're going to stand firmly on the side of patient privacy, dignity, and access to care. We're going to protect our providers, and we're going to make sure that California remains a safe haven for those who need it. I ask for your aye vote at the appropriate time, and with me today in support of the bill are Craig Pulsifer, the Legislative Director at Equality California, Tiffany Brokaw, Deputy Attorney General in the Office of Legislative Affairs, and also Haley Penn, Deputy Attorney General in the Healthcare Rights and Access section, is available here to answer technical questions.
Thank you.
Good morning, Chair and members. Craig Pulsifer on behalf of Equality California, proud co-sponsor of AB 1930. Appreciate some members of Zbur's leadership on this issue, as well as our partnership with Attorney General Bonta as well. AB 1930 is an important measure to build on California's existing protections to ensure that patients can access health care without fear that their personal information will be weaponized against them. Over the past several years, we've seen efforts by out-of-state actors to use subpoenas and investigations to target people seeking or providing lawful health care in California, including reproductive health care and gender-affirming care. These requests are often used to intimidate, create fear, and discourage people from accessing or providing care that is fully legal and protected in our state. And importantly, these requests are often directed not just at healthcare providers, but also at businesses that hold sensitive personal information. Without clear safeguards, those entities may be pressured to respond quickly, even when requests are overly broad or in conflict with California law. That's exactly why AB 1930 is needed. It puts in place clear guardrails before that information is disclosed, ensuring the Attorney General is notified, creating time to evaluate whether a request is lawful, and requiring that patients be notified as well. These are reasonable protections to make sure that patients and providers are not exposed to politically motivated investigations targeting lawful health care. It's also worth noting that other states, including New York, have already adopted similar protections. AB 1930 helps ensure that California remains a place where people can access lawful health care safely and without fear, and I respectfully urge your aye vote.
Thank you.
Thank you. Good morning, Chair and members. Tiffany Brokaw here on behalf of Attorney General Rob Bonta, who is a proud co-sponsor of this bill, and he thanks Assemblymember Zbur for authoring this. AB 1930 strengthens protections for patients receiving reproductive health care and gender-affirming care and the providers who serve them. It requires certain business entities to notify the California Attorney General when they receive an information request related to a legally protected healthcare activity. And it also authorizes the Attorney General to intervene to prevent disclosures from happening. Recent actions by federal and out-of-state officials have raised concerns about attempts to access private medical data. And it also has raised concerns about prosecuting individuals involved in legally protected healthcare. Without strong safeguards, subpoenas, investigations, and other legal demands may be used to circumvent California law and undermine the rights of patients and providers. I want to emphasize that the notification requirements don't kick in unless an entity plans to respond. This provides our office the opportunity to intervene and prevent these disclosures from happening in order to protect the privacy of patients and providers. And for these reasons, I respectfully ask for an aye vote.
Thank you. Is there anyone else here in support of AB 1930? Yeah, when the time comes.
Sorry about that, traffic. Good morning, Chair and members. Tracy Rosenberg on behalf of Oakland Privacy in support of the bill.
Thank you.
Good morning, Chair and members. Keshav Kumar with Lighthouse Public Affairs on behalf of Reproductive Freedom for All and our over 400,000 California members in strong support and appreciation.
Thank you. Is there anyone here? Anyone else here in support? If not, we'll go. Anyone here in opposition to AB 1930? I have to make a space for one more seat if we could. Thank you.
My name is Romy Mancini. I'm a former attorney for the ACLU Lesbian and Gay Rights Project, a member of Women Are Real, and a lesbian. AB 1930 is the latest brick in a wall California has been building since 2022 through SB 107, SB 497, and now this bill to insulate providers who perform sex-rejecting interventions on minors from any outside scrutiny whatsoever. Courts, parents, federal investigators, all of them blocked. SB 107 let a non-custodial parent abscond to California with a child in violation of a custody order. SB 497 blocked courts from accessing medical records. AB 1930 adds the enforcement mechanism. When a parent, a detransitioner, or a federal investigator seeks records through entirely lawful processes, the California Attorney General can intervene and kill that effort. When the DOJ or HHS issues a subpoena to investigate potential Medicaid fraud, this bill requires the provider to tip off the AG first and authorizes the AG to block disclosure. That is a textbook Supremacy Clause violation. You cannot interpose state machinery between a regulated entity and a lawful federal demand. The bill applies equally to family court subpoenas. A mother with a valid custody order in another state trying to find out what irreversible procedure was performed on her child without her consent will have the California AG standing between her and those records. This legislature would be making her legally helpless. In January of this year, a jury awarded $2 million to a young woman whose healthy breasts were removed by a doctor when she was 16. AB 1930 would prevent the next young person harmed by these procedures from ever getting those records and getting justice. This bill does not protect patients, it protects providers from patients. Vote no.
I'm Layla, and I'm a detransitioner. The doctors who removed my breasts will never be held accountable. The doctors who made my friend's clitoris grow so big to where they can't wear pants walk scot-free. This so-called privacy bill protects the monsters who wrecked our bodies, the healers who became butchers. It doesn't protect the thousands of detransitioners who can't even get their own medical records. The parents fighting custody battles across state lines trying to protect their kids from what happened to me. It blocks federal investigators from prosecuting clinics that committed Medicaid fraud by manipulating insurance billing codes. This bill shields providers so they can keep chopping up bodies. It wraps the doctors, the clinics, the gender industry in a legal blanket and says, you are protected from accountability, no matter who you harmed. There is no blanket for me. I live with the damage done to me at the hands of these providers every day. The people responsible just cash their checks. I was 13. I was just a child when a surgeon removed my breasts. I'm still trying to understand who knew what, when, and why no one's stopped it. Why the people who coerced my mom into consenting still have their medical licenses. If these treatments are as safe and as necessary as their defenders claim, they should be able to withstand scrutiny, shouldn't they? They should be able to withstand investigations. Why are you covering for them? You and the American people know that there's no defense for sterilizing children, but you set aside your morals and do it anyway. Is the money they donate to your campaigns worth my body? Is it worth my quality of life? Vote no, please. Thank you.
Is there anyone else here in opposition to AB 1930?
Meg Madden on behalf of CAUSE, Californians United for Sex-Based Evidence in Policy and Law, in strong opposition. Thank you.
Thank you.
Courtney Corbello on behalf of the Center for American Liberty, in strong opposition.
Thank you.
Sophia Laurie on behalf of California Family Council, in opposition.
Thank you.
Cynthia Cravens, associated with Women Are Real and Diag, Democrats for an Informed Approach to Gender, strong opposition.
Thank you.
Lisa Disbro, retired teacher, chair for Contra Costa Moms for Liberty and Informed Parents, in strong opposition.
Thank you.
Arian Adam Chikova, longtime San Francisco progressive Democrat and an LGB activist, mother of a formerly trans-identified young man, co-lead of the LGB Courage Coalition education team, co-founder of California Teachers Supporting Gender Nonconforming Youth, and member of Democrats for an Informed Approach to Gender, a veteran high school Spanish teacher, and a state council representative for CTA, and I stand in strong opposition to this bill.
Thank you.
David Bolhog, representing SFV Alliance, LA County chapter of Moms for Liberty, and TOPS, Taxpayer Oversights for Parents and Students, in opposition to this bill.
Thank you.
Jenny McGrain, nurse, midwife, lesbian, in opposition to this bill.
Thank you.
Sunil Vijaysekara, parent, grandparent, representing Democrats for an Informed Approach to Gender, Women Are Real, and Women's Liberation Front, in opposition.
Thank you.
Amanda Covatana, Democrat, longtime lesbian activist with Women Are Real, lesbians advocating for a resilient future.
Beverly Talbot from San Francisco, longtime Democrat, representing the Lesbian, Gay, Bisexual Courage Coalition, LGB Alliance, and Democrats for an Informed Approach to Gender, in very strong opposition to this harmful bill that is very anti-child.
Thank you.
Hello, I'm Johnny Skinner. I'm here representing GenSpect. I stand in strong opposition to this bill.
Thank you.
Nicole Young, Placer County Moms for Liberty Chapter Chair, and I represent millions of California parents who have no idea what you people do every day. Strong opposition.
Barbara Walker, lifelong Bleeding Heart liberal from the San Francisco Bay Area, mom of 3, member of Women Are Real, in strong opposition. Thank you.
Ariane Geringer, longtime resident of Oakland, California, and from LGB, Lesbian, Gay, and Bisexual Alliance USA, in strong opposition to this bill.
Elizabeth Cronin, lifelong Democrat, member of CTA for 35 years, member of Women Are Real, and Democrats for an informed approach to gender, in strong opposition.
Thank you. I'm going to ask if our secretary can establish quorum, please.
Kalra?
Here.
Macedo? Here. Lee? Bryan? Connolly? Here. Dixon? Harabedian? Pacheco?
Here.
Pappen? Here. Sanchez? Stephanie?
Here.
Zbur?
Here.
And are there any questions, comments, or motions? Yeah. Yeah. Is there a second? And a second? Any questions, comments from anyone? I want to thank the Attorney General as well as Assemblymember Zbur for bringing this forward, as indicated in the appropriately in the staff analysis. Full faith and credit doesn't does have exceptions and exemptions in terms of legitimate public policy, and I think that our state has made our public policy clear on this matter. Would you like to close?
Yes, Mr. Chair, members, thank you very much. I want to thank the folks from Equality California and the Attorney General's office for being here with us today. Just wanted to commit to continuing to work with the Cal Chamber and the Hospital Association to address their concerns. I think there's some things that they raised that are legitimate, that we can tighten up the bill, and so we're going to continue working with them. The discussion on this bill, was complex, as it is for many other bills that are brought to this committee, but that's the reason why I authored the bill. And the reason for it is simple. Decisions and information about protected health care should be in the hands of the patients and their providers, and that's it. No one should have to fear that seeking lawful medical care could put their privacy and safety at risk. Not transgender youth, not people seeking reproductive care, not LGBTQ plus Californians, not anyone. And this bill simply allows the Attorney General to know health care is under attack and to be able to step in and protect patients and providers. Every patient deserves to be safe, seen, and to be cared for. And with that, I respectfully ask for an aye vote.
Thank you.
Motions do pass to public safety. Calra?
Aye.
Calra, aye. Macedo? No. Macedo, no. Lee? Bryan? Conley? Aye. Conley, aye. Dixon? No. Dixon, no. Herbedian? Pacheco? Aye. Pacheco, aye. Pappen? Pappen, aye. Sanchez? Stephanie? Aye. Stephanie, aye. Zbur?
Aye.
Zbur, aye.
All right, we'll place that on call. Thank you.
Thank you very much.
Assemblymember Jackson, file item number 2, AB 1584. And while he's approaching, we have a motion on the